Dear students, our today's topic about acute radiation sickness, combined radiation defeats, and it's about military pathology, but possible in the peace time, some disasters, and of course we remember some catastrophe from previous century. And first of all, definition of acute radiation syndrome is radiation poisoning and radiation sickness or radiation toxicity is the same. First of all, we have specific condition when present within 24 hours exposure to high amounts of ionizing radiation, more than 1 gray, and a short period of time, and this dosage both very important for diagnosis, both position. We remember about Chernobyl catastrophe, Fukushima catastrophe also, of course we understand that situation may repeat in the future and collect knowledge about this problem, very important. And we have very narrow specialists, but general physician also should know all about this problem because it's very important for primary diagnosis. And if something happen, all doctors of all profession includes in the process of treatment and diagnosis. And first of all, about signs and symptoms of this type of problems. Different form of acute radiation sickness may be hematopoietic form, gastrointestinal problems may be gastrointestinal form, neurovascular form, and usually only first form, hematopoietic form, associated with good prognosis. Others form, unfortunately, very bad possibility for treatment in case of form except hematopoietic, and despite of proper treatment, patient will die in nearest future after diagnosis. And hematopoietic form. Name of this form associated with problems, and the main problems of that due to damage of blood cells and bone marrow, and finally we have aplastic anemia in this patients, and some complications of this condition like infections, symptomatic bleeding, anemia, due to decreasing of red blood cells, white blood cells, platelets, and dosage 1 to 10 gray associated with this form. And also we should understand that maybe additional problems after explosive damage. We have additional trauma of the body, and also maybe additional effect which come after combination of thermal damage, and also we have surgical problems, and we have finally clinical features of acute radiation sickness. And we should decide first of all surgical moments, and then treat acute radiation sickness, because if started manifestation form of acute radiation sickness, problems with surgery treatment will be, and risk of death more than in separate damage with acute radiation sickness in case of absence of combined radiation defeats. And gastrointestinal form associated with dosage of 10-20 gray. First manifestation with nausea, vomiting, loss of appetite, abdomen pain, we can see gastrointestinal symptomatic first of all. And without specific treatment, but in case of specific treatment also, risk of mortality is very, very high. Neurovascular form, more than 20 gray, dizziness, headache, decreased level of consciousness, and occurring within minutes to a few hours, and with an absence of vomiting, and this is a fatal form. Unfortunately, patient die between some hours or days, but despite of proper treatment, cases of recovery are very, very rare. About stages of acute radiation sickness: prodromal stage, latent stage, manifest illness stage, and recovery or death. Prodromal stage in different form. For example, first form, hematopoietic form, prodromal stage includes nausea, vomiting, maybe diarrhea if exposure more than 6 gray, headaches, fatigue, fever, non-specific changes, and duration of this stage may be some minutes, maybe some days. And as more duration is worsening prognosis, and because prolonged stay this prodromal stage associated with high dosage of radiation. Nausea, vomiting also, if only single, it means dosage is not very high. If multiple vomiting, if multiple diarrhea, usually we understand that dosage is very high, close to second stage, gastrointestinal stage. Okay, and latent stage. Latent stage when symptomatic decrease and patient feels not so bad, and duration of this stage may be some hours or some weeks. It depends on dosage. If dosage only 1 or 2 grays, maybe up to 3 weeks. If very high dosage, for example 9 gray, may be absent at all. Okay, and manifested stage with leukopenia, thrombocytopenia, anemia starts after latent stage. For example, in case of 1 or 2 gray, after even 30 days may start, and during this time patient usually continue military activity, and then should be hospitalized for treatment, and sometimes we also describe skin changes after radiation, maybe redness, maybe itching, and maybe even formation of blistering, and we have also atrophy, fibrosis, skin pigmentation, ulceration or necrosis after this exposure, and we can see skin changes like this, maybe, and secondary changes appear in manifested stage due to some infections in case of agranulocytosis. Okay, and about first form, more often appearance of hematopoietic form, and even this form we may distribute to mild or moderate, 1 or 2 gray, usually mild form, 2 till 4, usually moderate, 4 till 6, moderate to severe, and more than 6, usually severe form, and second form more than 10 gray, usually 6 or 8 gray associated also with bad prognosis, and more than 8 gray, obviously prognosis is bad, but 1 till 10 usually we check as a hematopoietic form, and greater than 8 we have severe cause of disease with nausea, vomiting, severe diarrhea, electrolyte disturbance, shock, and greater than 30 gray, patient died in the nearest 48 hours. Okay, and for diagnosis, diagnosis of acute radiation sickness can be difficult, and we use clinical features, we use laboratory tests, we use dosimeter, we use also duration of latent period for diagnosis, and prodromal stage duration, and how many symptoms present in this prodromal stage. It's also very important information. From laboratory test, we usually check lymphocytes count in the uh, first and third days, and then total leukocytes count in the 7th day. And also, if we may provide direct dosimetry, it's very good for diagnostics. And also, we may check internal radiation with specific device. And course, about patient management. First of all, we should check condition of the patient, ABC tactic, and present pulse in the carotid artery or not, present respiratory movement or not, blood pressure, blood gases, electrolytes, urine output. We should treat the major trauma, burns, respiratory injury, and then we should provide symptomatic treatment for first reaction, and also we should be ready to blood transfusion, to stem cell transplantation if it's possible in wartime, and in case of any disaster, and we should look for proper donor, and be ready with growth factor, and also should prescribe antibiotics for treatment of infections in case of agranulocytosis, and should prescribe thrombocytes for bleeding, and also transfusion of red blood cells in case of severe anemia. Okay, and first treatment is symptomatic. For vomiting, we prescribe antiemetic drugs, and we prescribe treatment of electrolytes solution. We prescribe disintoxication therapy, and additional quantity of liquids, and also very important non-pharmacological help, remove additional quantity of radiation substances from the clothes and from the skin, and psychological support is very important. Also, we should prescribe additional treatment with stem cells transplantation if we have proper donors, but the time of this treatment in manifestation stage, and uh, after additional treatment with transfusion of cells, and after immediately treatment, and then we should be ready for stem cells transplantation if it's possible, and also specific prophylactics of neutropenia we may provide, and first of all remember about late effects in case of acute radiation sickness. We may treat properly, but after some period of time may start leukemia, and we saw this fact in case of Hiroshima and Nagasaki. Very big quantity of patients with chronic myeloid leukemia, acute leukemia, maybe thyroid cancer or cancer of others localization, breast cancer, and increased risk of cardiovascular disease after exposure, lung injury, fibrosis of lung. We can see in oncological patients these examples after radiation treatment, and fortunately, even in the next generation may appear some problems, teratogenic effect of this type of radiation. It's very popular, and we have pictures of patients before acute radiation syndrome and after, 3 weeks later. First of all, loss of hair and Jordans we can see, and severe condition of patients, and of course it's due to high dosage of radiation, and in spite of recovery, maybe some late complications after this. And radiologist, oncologist, hematologist, and general physician may treat these patients, and also deal with late effects after this exposure. And about combined radiation defeats, if presents combination of them, we should understand this patient is the first for treatment, first line for evacuation, and we have more severe condition than all of these problems separately present, and it's multiple damage of tissue and organs, and of course the treatment should be organized very well, and first of all decide surgical problems. Thank you for your attention.